Hello, everyone. Welcome back to another episode of Professional Roundtables with Arrows Education. Today, we have the privilege of speaking to Emily Wong, who is a speech therapist and a friend that we have gotten to know through a conference together, and has been such a privilege to know what she does and her passion in the field, as well as her experience in here. And we thought it would be really interesting to get to know about this profession that we don't usually get to talk about, which is speech therapy. But before we begin, I would like to let you know, like, what does Arrows Education do? If we can have the slides up. Arrows Education is an education consultancy and agency. We have presence in over 30 countries, working with 2,500 institutions across the globe, offering thousands of courses in all the fields from K-12 to PhD. We are your most affordable support service to realize your dreams of studying abroad. How do you work with us? And we would uh, invite you to visit us on our website on arrowstransactions.com. And on the website, complete an applications form, and we'll reach out to you with all this attachment that is required, your transcripts and all that. Will help you and consult you what are the best options that are available for you. We'll also help you to complete your applications for study visa, so that you can travel abroad as well. And so, if this is something that you want to do, realizing a dream that is studying abroad and experiencing life outside of your own country, would love to help you realize this. So reach out to us and contact us on all our social media platform, on our website, as well as on WhatsApp. All right. Thank you. Without further ado, it's such a privilege to introduce Emily Wong to you. Can we bring up our guest, please? Hi.
Hello, everybody. Hi, thanks for having me, Dr. Japoset and Josiah.
Hello.
Yeah.
So,
George.
Yes. No worries. Yeah. And it is such a joy, always a joy to talk to you. And
Thank you.
we had a really great conversation before we started. But why don't you help us get to know you? Like, tell us a little bit about who you are and what did you do? What's your experience like? Yeah.
Okay, I am Emily. I am currently based in Hong Kong. So the reason they asked me to do this is because I was a speech therapist. So that's the main gig. But yeah, before that, I actually in my undergraduates I studied in Australia. So okay, backtrack. I was born and raised in Hong Kong. And then in uni, I went to Australia to do my Bachelor of Arts in Linguistics and Applied Linguistics. I graduated, came back to Hong Kong, did several other jobs. I worked in a school in an admin role. I then changed to working in a church in another admin and event planning role. And then I went on to study a master's degree for speech therapy, and that took 2 years. I graduated, worked as a speech therapy for 5 years. And then I actually changed course to do I did freelancing in bread making. I teach bread making. And then I became a full-time mom. So now I'm a full-time mom based in Hong Kong. That was my a very
bread make-
general work career history. Yes, bread making.
That's
Yeah.
interesting.
So she was from a breadwinner and into a bread maker, and
Bread
now
maker.
Yes,
a
and now
homemaker.
Now a bread eater.
mumming. Yeah, yeah, it made me reflect on how many different roles that I actually have, and yeah, a pretty interesting spread of different jobs that I had.
Well, yeah, that's so cool. Uh, we also talked a little bit about what you were dreaming of when you were young. So what led you to pursue linguistic as part of your study you mentioned,
Mm.
and eventually specialize into speech therapy? Like, what were some of the inspirations?
Some of the inspiration was definitely what I was interested in. When I was in secondary school, I was very interested in documentaries about nature and animals. And that led me to want to study in Australia for uni, to do some environmental studies related subjects. And then I took a linguistic elective when I was
Active.
first year, first semester, and I
Okay.
instantly fell in love with the world of language acquisition, phonetics and syntax and grammar, and that led me to my linguistics degree. And then I thought, with my linguistics degree, what can I do? To be honest, not much. And speech therapy was quite a natural next step when you have a linguistics degree. And that is
Mm,
how, when I was considering to become more professional instead of just doing admin roles for the rest of my life, that is quite a natural decision to go into speech therapy.
mm,
Yes, it
yeah.
was so natural that I did not take the time to find out what exactly speech therapy was about, and that was a mistake. If you are listening to this and considering, go find out for yourself. After listening to all this, go find out for yourself what exactly speech therapy was about. I did not actually know that speech therapists worked with adults or work with swallowing, because
Mm.
speech therapy works with speech and communication. I did not know that they do swallowing as well.
Yeah, yeah. I think I'll be more interested because you mentioned that you studied linguistic. I think some of us may not like naturally consider it, but if you're in the case of being a Malaysian, sometimes you get put into courses that's not really your top choices, and linguistic
Uh
could be
huh.
one of them that you get yourself into, and so if one of our audience for some reason ends up taking
Got
a
placed
linguistic
into a
degree,
linguistic degree.
yeah, and it's not necessarily a bad thing, right? And
Mm-hmm.
we want to let them know like, hey, how can you pivot from there? What are options that are available for you even when you do this?
Mm.
So like when you completed your linguistic study, what were actually the doors that were available for you to pursue as a profession?
Research,
Mm-hmm.
academia. It's another very natural path that I was almost I almost took. Yes. Teaching is another one. Other than that, beat me. I cannot think of any. So, but then I must caveat and say, you I think it is true not just for linguistics, it's for many other arts degree or any degree in general, for that matter, that you acquire soft skills that is necessary for many jobs.
Yeah.
And especially in this day, age and time, your actual degree does not matter as much unless you're in a professional degree, say nursing, speech therapy, or medical doctor. You can land, you can have many opportunities regardless of your degree. And I think the soft skills that you acquire in your degree, in your uni life, is going to help a lot in any job that you are going to pursue.
Yeah. Yeah, I guess this thing comes back up again, Sadie. Like this soft skill thing. I think a lot of us starts off in our uni or going into university thinking that, oh, this must be something that I will be doing with my degree.
Mm,
But a lot of times I think life just throws us around and sometimes it just doesn't happen. And it matters how we make use of what we acquired, all the soft skills, and that can carry us and opens up more opportunities or keeping us flexible. It's something that
mm,
I think as parents and as audience are catching, it's something that you should consider as well. Like even if you're not getting what you want for your degree or your undergraduate study, it doesn't necessarily mean that's the end of the world for you.
mm,
There's a lot of way that you can be flexible and pivot and make changes as well.
Yeah, I think one of the reasons why this program is very important for us is the fact that it helps school leavers, especially because that's like the time to be really confused in life when you're getting out of high school and there are so many options and everybody has an opinion
Mm,
except daddy wants you to do this, mommy wants you to do this, your colleagues want you, even your teachers have opinion on what you should become. So at that time, I think it's very difficult sometimes for students to make a decision. So one of the things that parents are realizing now, hopefully they take to that, is the fact that your first degree, I think these days, is just for you to get exposed to the world.
mm,
It's now, it's sometimes it's totally out of what you're going to be doing in later in life. I studied chemistry. my first degree, my first degree was chemistry, and my second degree was organic chemistry. So
and
today, what I'm doing has absolutely nothing to do with the laboratory.
yeah,
Yeah.
reminds us again, Dr. Vasedi, what is your PhD in right now?
I have a PhD in educational technology.
It's nothing to do with organic chemistry.
There's no relationship.
Yeah, so it happens,
Yeah.
it happens, and I don't think we need to have one set path that we really want to. That would be the most ideal, but there's a lot of things that we can't control,
Yeah.
and being flexible with it, you'll still be able to find success or a way out from it. Yeah.
Yeah. At the
Um,
end of the day, it's just what you enjoy doing. Like once,
Exactly.
if you find what you if you pursue what you enjoy doing, like it is the, do not think about the result. Enjoy the process of it. The result will just
mm,
come. Yeah.
I think at the age of leaving high school, most people don't even know what they enjoy.
Yeah.
They
I
have
wanted
no
to become a
idea.
kindergarten teacher and an environmentalist.
Yeah.
mm,
Yeah.
yeah, and so yeah, you mentioned some doing what you enjoy. Is speech therapy something that you actually enjoy doing, and what is it really
Yes,
about?
I find out later that yes, I actually enjoy doing it.
Mm.
Um,
Tell us a little bit about that. Yeah, like what speech therapy really is and things like that.
okay, so people generally know that speech therapy is something to do with communication based on the
Mm,
name of it. But other than communication, we also actually work with people's swallowing mechanism. So we speech therapists work in a variety of settings, from ranging from hospitals, clinic, schools. I used to work in a nursing home, private practice. They worked in all these settings with children, all the way to adults, elderly, on their communication and swallowing problems. That's in a nutshell of what speech therapy was about. I went into the program thinking that we only work with communication in children. I was so wrong. I was not mentally prepared. What I got myself in. Um, yeah, but then I quickly find out that working with adults, specializing in swallowing problem, was actually something that I enjoyed doing. So I graduated and I started working in a nursing home with old people, old folks. And after that, I worked in a home visit organization, an organization that provides home visit services. We go to old people's home to provide speech therapy service. That includes assessment, assessing what problems they have, what we can help them with, how severe is their communication or swallowing problem, and providing treatment and recommendation for how they could cope, manage, or improve their problems.
mm.
Mhm.
Interesting.
Hmm.
Okay, what is what would the day to day look like for a speech therapist, like giving a treatment to an elderly in your case, yeah,
Hmm.
about with his swallowing problem.
Hmm. Hmm. We, when I was working in a nursing home, it's not one of the toughest. It's not, the schedule is not
Mm,
packed. and I
Okay.
like that part of my job. I go into the nursing home in the morning. I find out what referrals I get from the nurses. So usually nurses will notice something is off with this person's swallowing, or during mealtime this person exhibits some difficulties. They write a referral to the speech therapist. Hey, go look at Mary on the third floor. So I go and look at Mary during Mary's mealtime. I would watch her eat. It's actually a very interesting job. I sit by Mary's side. I watch her eat. I do some oral motor and communication assessment, and then I just watch her finish her meal and see what difficulties she has. And after the meal, I write my recommendation or to back to the nurse. Mary has this and that disorder problem. Let's downgrade her meal to a puree meal for this amount of time while I work with Mary on her swallowing. And so that's the assessment part of it. Then after the meal time, maybe I'll have 2 sessions of treatment with some other residents. And that will involve some form of exercises with their swallowing muscles, or some communication exercises, some naming exercises, some oral motor exercises that would help them articulate better. And then come another mealtime, I will go look at another patient and write some reports, and that's the end of the day. So yeah.
Okay. I hear a lot of words like treatment, like reports, like
Yes,
observation. That sounds very much like a medical practitioner. Are you
it is
considered a
actually.
medical professional in this case?
Yes, I am considered a medical professional. It's at least in Hong Kong. Yeah.
Mm,
Yeah, we
at
are
least in Hong
considered the allied health
Mm,
profession, which you would always find in hospitals, and now you would often find in nursing facilities. You would often find them in special needs schools. You would find them in training centers. But yeah, I guess if you work with children population, you are considered less medical than if you're working with adults, just because of their medical needs. And especially if you're working in hospitals, then yeah, you're considered even the most medical
mm,
groups of speech therapists. But yeah, I
mm.
like the medical part of speech therapy, and that's why I pursued I started working with the adult population. Yeah.
Wow. So in certain countries, speech therapy is considered medical professional. Do you have to pursue a medical degree to get into this profession?
You do not have to, um, but a part of your program will usually include an anatomy and physiology course, which was hardcore. They would
Mm,
usually be in your first semester, and they will throw at you a bunch of medical terms. You are expected to know all your medical terms, or your how to read a medical chart, your anatomy and physiology of your communication and your swallowing mechanism, the neurology, what nerve damage causes what symptom and sign, and as a result what disorder. So it is really medical.
mm,
I know, not in my case, not in my master's degree, but I know in the undergraduate degree in Hong Kong University, they do dissection as
mm.
well. So you actually work with real bodies. Yes.
So does someone need to have a science background to get into this field?
Beneficial, but not necessary.
So what,
Wow.
how
I
will
was
some?
able to. I graduated with a linguistics
Yeah,
degree,
so
and I did not actually in Hong Kong. Your secondary school education is divided into the arts stream and the science stream. I did not even go into the science stream. I was an arts person, and I
so how
didn't.
did you manage the anatomy and physiology
It was
part?
tough. It was tough. I did not do very good in that module, but I managed. It's just hard work, route memory, studying, cramming all your medical terms. It is
Mm.
possible.
Yeah. Wow, this sounds like a great opportunity and possibly a door that a lot of people haven't considered. Like in certain countries, this would actually lead you into medical field without actually
Yes,
having to go through science stream, which is really
yes,
interesting.
yes,
Yeah.
yes. It was really interesting. I get to work with nurses and doctors when I was in the nursing home, and I
Mm.
get to sometimes tell the doctors what to do.
Yeah, yeah.
Yeah,
That that
yeah.
that
This is
that makes
something
it
that I
worth
did
it, right?
not. I did not expect this before I go into the program. Um, you you actually get pretty close to being. You are in the medical field actually, especially if you
Mm.
work with old people in a nurse in a hospital. You get to wear those uniform. And in
Mm.
my because part of the program, I haven't mentioned this yet. Part of the program, I did a 2 years program. The first year is all theory, classes, lectures, tutorials, discussion, and case studies. But the second year involves practical. So you go and do um, go and do placements in different settings. And one of the settings that you have to complete was a hospital setting. So I spent 3 months in a hospital following a speech therapist around. Doing ward rounds, we have to read medical charts. I have to know what all those numbers mean to their blood pressure, to yeah. I have to know what they mean to their communication and swallowing. So, and then I get to write in the medical report in the medical charts, give it back to
Do
the
you write like a
nurse.
doctor too?
Da, da, da. No, you can, only doctors are allowed to work to write like a doctor. If you write like a doctor, you get told off by the nurses. Uh,
Oh.
but yeah, it was a very special experience, daunting, but at the other side of it, I would say it was a very memorable and valuable experience.
Nice.
Mm. Yeah. I guess because in Malaysia we also divide. I mean, I feel like Malaysia education system has some semblance to Hong Kong education system because we were both British colonies.
Mm,
But so we do divide ourselves into art streams and science streams as well. And there's usually a lot of like I would say certain prejudices against art stream.
mm,
And like if you want to be a doctor or in the medical field, you just kind of have to go into science streams.
yeah,
But
yeah,
this is something really new. That something for our parents and our students to consider as well. Like even if you somehow ended up in art stream or you decided to want to do an art stream, but you still want to get into a medical field, uh, speech therapy could be something that you can consider as well.
mm, mm-hmm,
Not it's a path less, it's a road less taken, I
mm.
would say, but it does lead you to Rome,
Takes more
so
work, more
takes more work.
turns, but eventually you
Yeah.
reach there.
Yeah,
Yes.
as with any profession, you kind of have to work your way through.
Yeah.
I don't become an engineer by just drifting through university. Kind of have to put in the work as well. Um, Maybe I should have put in more work than I did, but yeah, I have to put in the hard work too, and any success comes with that. Um, yeah, thank you for sharing that. I think it breaks a lot of mold, a lot of
Mm,
uh, a lot of perceptions about art streams for our parents. So
yeah.
so if they, yeah.
And a little more on that. I think being in an art stream or having that training in liberal arts have given me the sensitivity to languages, to communication that perhaps I would otherwise not have. And a lot of the people skills, the I think I honed it while writing my essays, uh, dealing, having in class debates with fellow students, and I think that helped me in some way too. So, yeah, arts is good stuff.
Mm,
So, what
yeah.
about the downsides of the job?
Of the job.
Downsides of the job, yeah.
Pressure, a lot of pressure, and the pressure doesn't just leave you after the day's end of job. It follows you home as well. So even at home, you are thinking about the patients that you met that day. What could I have done better, or should I have done something differently? You would never know because there is not another chance to do something differently. But that thought just lingers, and you keep thinking about that patient, that meal that I recommended, or that treatment that I performed. Could I have done better? So that pressure. There is also pressure because it's sometimes a life and death matter. Like you have to do your assessment right. You have to do your recommendation right, because sometimes if you miss something, that can be very costly, and in some cases it could cost life. So there's that pressure as well. That is if you work with swallowing problem. But I know of colleagues who work with children. The pressure comes from rising up to the expectation of their clients, which includes the parents of their children. So what if I did not, within a reasonable time frame, improve their language? That would have consequences in their future education and just communication. So that pressure as well. But I guess if you work in any medical related or any health related profession, that pressure is going to stay with you. Yeah.
Yeah, because you're really dealing with people's life or their
Yeah.
quality of life,
Yeah.
and it affects them.
Yeah.
That could be a really heavy pressure on us.
Yes.
Yeah.
Especially when you first graduated, you left the comfort zone of having a professor, having a supervisor to on you. You're on your own for the first time. What do? You don't know. So most of the time you didn't know what you were doing until one day you just become more confident in your clinical skills, and that side of the pressure reduces. But the life and death and the responsibility you have on your patient kind of pressure always would be there.
So I'm curious about how you relate with your patients. So are they usually aware they have been scheduled for speech therapy? Are they expecting you? Do they know what you're going to do when you come? Because like for me, it feels creepy. Someone just watching me eat. So
Yes. That I can tell you safely, many of my patients think it was creepy that somebody was sitting next to them watching them eat. But I like people, and I think people's skill is one of my biggest strengths. So I do not just go to the dining table, and just sit next to them and just eat this vegetable in front of me. Just drink your water so I can see if you're coughing when you drink your water. I would talk to them first, build rapport and tell them, I have this interesting job. I watch people eat. And I explain to them why I do this and what will happen after the meal observation. Generally, the patients are pretty happy that somebody is sitting, especially in my case when I work in a nursing home. They do not get attention from many people. So I am that presence for them. And in many cases, I might be the only presence in that day for them. So they enjoy the company, many of them. And yeah, not many of them understand what speech therapy is. I would say most of them did not understand what speech therapy is. They did not understand why am I downgraded to a puree meal? Why am I not eating the chicken wing that my next door neighbor is eating? It takes a lot of work to explain to them. But eventually, if you have the right skills and you talk to them in the way that they would understand, usually they would understand eventually. Yeah.
So will you say someone who is going to go into this field needs people skill? Anyone who doesn't have should not venture?
Now,
Hmm.
theoretically, yes, because
Okay.
because I think now this field requires many skills. People skill is one. Organizational skill is one. Logical and critical thinking is another. Being able to prioritize your work and working independently, but especially but also with a group of other profession is also key. Now, in my opinion, organizational skills, critical thinking, and logical thinking can be trained. People skills, I am not so sure.
Oh, okay.
So I would say let's just put it this way: it is required. You need to have good people skill. You need to enjoy being with people, and be able to effectively engage with other people. I think this is true for most healthcare profession, and especially true if you are a speech language pathology, which in some other countries it's referred to speech language pathologist, speech therapist in Hong Kong, and I think in Malaysia as well. Yeah, if you're working with speech, you've got to be reasonably good in communication. I would say,
Yeah,
yeah.
no, you just be a bad therapist, like we have some bad doctors. But
There are bad doctors there, unfortunately, and usually it's not about the skill. It's not about their clinical skills. It's actually how they listen to you, how they
exactly.
responded to your requests, that made you decide whether they are a good doctor or a good clinician. Yeah.
When I was in elementary school, I had an encounter with this doctor. He's the only doctor I can remember his name as someone that I encountered. And it's not because of anything good. It's just because he was the worst. He was the worst doctor in the entire hospital there. When you see him, I mean, I think there have been about 2 or 3 occasions that I had to see him. The way the hospital was set up then, when you get there, they pull your card. Of course, there was nothing digital then, so they pull your card and then they assign you to a particular doctor. Then there will be someone, maybe a nurse or a ward aide, who will come and say, "Okay, these names. You sit here. You are going to be seeing this doctor." I just
Mm.
go home. I leave. I just go back home. The moment I hear that my name is, because when you meet him, he's not even looking at you, he's not listening to you, he's
Mm.
just writing. Before
Mm.
you finish to saying what the problem is with you, he has finished writing whatever he wants to write. And then you just get out, get out, get out, like that's the attitude.
Yeah.
So I can imagine. Of course, he was
So
a doctor, but
yeah,
a
there
very
are health
careful.
professions out there like that, but let's not be that type of health profession.
Yeah.
Yeah.
Yeah. Well, thank you for sharing that. I think it's so interesting to practice medicine that requires you to communicate with your patient well. I think it's one of the most important skills to have because people needs care, people need
Mm.
all this, and having that natural affinity to communicate and to love people, I think it helps a lot.
Mm.
Um, I think one of the questions that our parents or even our students would really concern, because this is not a job that is quite, how would say, common to talk about, and so
Mm.
we don't really have a baseline of what money kind of you're making. So the question of money always come back. And so, what kind of salary are you looking at? Salary range are you looking at being a speech therapist in your case in Hong Kong?
In Hong Kong, it's actually a pretty good paying job.
Mm,
Yeah, when we were talking beforehand, it's actually
mm,
within the mid-high range of salary, um, which is pretty good
mm-hmm.
for an arts person.
Yeah.
Yeah. Are we talking about numbers?
Yeah, we're talking about numbers.
Starting, I think I started at 37K monthly Hong Kong dollars,
Mm-hmm.
which is about
Okay.
15,
It's
18K.
about 18,000 ringgit Malaysia.
Yeah,
Yeah.
monthly. That is
Yep.
starting. Yeah, and we get well, in my case, we get yearly increment. Yeah.
Mm-hmm. Okay. Yeah. With that amount of money in Malaysia, we would be like in the top 20%.
Yeah.
But of course, living
Living
expenses
standard is
in
very
it's
different.
very different here in Malaysia
Yeah.
versus Hong Kong. So that would put you somewhere in mid high. I think with that range, you are probably making about 6,000-7,000 ringgit in Malaysia, which is about
That's a generous.
about
Uh,
something that an engineer would make by the time they hit about their fifth or their 6 years in the industry. So that makes it like on par with most professional jobs here in Malaysia. That will also put you in somewhere mid high as well. And so it's a really comfortable salary to draw in certain countries. I think in Malaysia, the range for speech therapists is still a little lower, a huge chunk lower in a sense because speech therapists are actually not considered medical practitioner in Malaysia. So you really have to like put yourself in the countries that plays well. Yeah, so if you're a speech therapist, probably Hong Kong is somewhere that you can go to. But Emily might think otherwise because expenditure here there is so expensive.
no,
Yeah.
it's still considered a very comfortable salary, even in Hong
Mm,
Kong. Yeah.
yeah. Yeah, so that's good news, right? If even for arts students, I think a lot of people just think art students are going to come out poor. That's not always the case. Then it's good news for a lot of
Yeah,
us.
it's possible.
It's possible. Yeah.
So, what
So
would be some other options to consider? I mean, with your experience doing speech therapy, let's assume you just don't feel like continuing in that line. What are
Mm,
some other areas that you can pivot to that will you'll be able to use the skills that you already got from speech therapy?
mm, mm. Um, Again, research and academia is yeah, one path that I actually personally considered, but given up eventually. And then there is it actually leads pretty neatly to a audiology. So audiologists would often require some form of knowledge in speech therapy. Whether or not it requires a speech therapy degree, however, is up to the institute that you decide to study audiology with. But audiology is one path to take, and some of my classmates have actually taken that path and become a speech audiologist in the UK. Actually, yeah.
Okay,
hmm.
I've not
uh,
heard of that in Malaysia. Does Malaysia have audiologists?
I don't know.
I'm
I hope they
sure.
do. I
I'm
hope they
sure
do
there
because
is probably only in bigger hospitals or major hospitals and private clinics.
yeah.
So, how is their job different from that of a speech therapist?
They usually work with hearing problems. So those that prescribe hearing aids, those that treat ear and audio processing speech problem that is the result of not being able to hear properly is as their
Yeah,
forte.
that's connected. Yeah, because you
Mm,
can't you
yeah,
can't make sounds that you can't hear.
yeah, yeah.
So okay.
Interesting.
Yeah. I think Malaysia we would just consult an ENT doctor. I guess I'm guessing.
For a
So
hearing aid, for example.
for hearing aid, yeah.
Yeah, yeah.
So ENT doctors actually make a lot of money in Malaysia.
Hmm.
Yeah. Yeah, because we're not the best listener, to be honest. But uh, I hope we do have professions like that. Um, I think Emily, I'm really interested because you mentioned you studied in Australia. What's that
Yes.
experience like for you? Because a lot
Oh,
of our students
awesome.
actually is looking forward to studying
Yeah.
abroad, right?
Abroad.
So tell us a bit about that experience.
It was, it's almost life changing. Of course, with university, with university studies is a life shaping phase in your life, and being in Australia actually I think helped me. It opened my eyes to many more possibilities. I see
Mm,
in a wide range of my classmates, my housemates, my friends, what is possible for them, and a and also a wider worldview, a a more intense class discussions. I've never seen people debate like that. And just being able to picnic outdoor after class, like there's a lawn and you just bring your sandwich and people have like umbrellas that you poke into the lawn and they just lie there and have picnics between classes. Unheard of in Hong Kong, or I assume
Sounds
in
nice.
Malaysia too. So yeah,
mm,
it's the outdoor, it's the atmosphere, it's the academic atmosphere, it's the social atmosphere, the culture, the coffee, and it's just being away from home and having to be independent for the first time pushes you pushes your limits a lot and pushes you to quickly learn many things and be open to many things. And I think that experience, on top of the degree that you will eventually get out of that experience, is very important.
wow. Yeah. I think I did have an opportunity to study abroad. I did have the opportunity to move away from my home state and move somewhere to study. I guess that's eye opening enough for me. But I really encourage our audience, if you do have an opportunity to
Yeah.
get a scholarship or something to go study abroad,
Yeah.
or that you can actually afford studying abroad. I think it's a dream that's worth pursuing, and because it opens up, like Emily says, open up so much of possibilities of your worldview, of what's possible for you as well. I think sometimes if you stay in where you are and in the country that you are, you see what's only limited in your own country. So I think it would be great opportunity to learn what other cultures are doing, or what other people are doing, and forming what's possible for you as well. And so I encourage you to pursue this dream. It's on your mind. There's scholarships available, if your parents are available to support, and if you're a parent and you can afford sending your children out there, yeah, do that and let them to put them in a space where they have to learn how to be independent and solve problems for themselves would immediately grow them from boys to men. And and I think that's always true. So reach out to us, Arrows Education, and we have consultants and professional consultants that are able to advise you on where you can go and what are the ways you can achieve that dream as well. Yeah.
Okay. So while still on studying abroad, I would like you to address the issue of culture shock. That's one of the questions I get asked a lot by students. Two
Hmm.
things: culture shock and discrimination. Did
Hmm.
you experience any of those, and how did they come? How did you deal with them?
I was in Melbourne, Australia, about 15 years ago.
Okay.
I would say back then I have not personally encountered discrimination, but I have definitely, my friends have, that I have experience with friends who have had been discriminated against. on trains, on public transport, they would get told nasty things just because they are Asian. So it's definitely there. It was present. I'm not sure about 15 years later now. I would like to say that it is the situation would improve with time, but then part of me also think that with time maybe more tension has accumulated. So I don't know, but definitely there is it is always a thing that you have to prepare yourself for, like think through what you would do if you get told to go home. Remain calm and just stroll by and mentally rehearse what will happen. It's because it is possible. I'm not gonna lie. Yeah. I just have not personally encountered it. But culture shock, I would actually say it's mostly a good kind of culture shock. Except that restaurants and supermarkets do not open at night. Other than that, it's actually my experience has been pretty pleasant. The people, Australians, were nice. I get to pick up Australian culture that I married an Australian husband. An Asian Australian husband. So we can always joke about Australianism that I've encountered during my time there. People are laid back. People are friendly. People love coffee, and yeah. Also, all those sort of things were pretty pleasant to me. I guess I'm a pretty flexible and open person as well, so it helps a lot. Like when the supermarket does not open at night, I'm not going to go like, "Oh, this is terrible. This country is backwards." Like you just learn to deal with it.
Yeah.
So another piece of advice is if you choose to study abroad, be open. Like not all countries are like your home country, and that is okay.
Yeah. And they should probably have more Chinese people in Australia as well, so they have
I
more
think
shops
so.
that opens until late night, you know.
I know, right? In Chinatown, they probably do. Near the university, they have a supermarket that opens late into the night.
Okay,
Late
okay,
into the
yeah.
night. It means 9 a.m., 10 a. I mean 9 p.m., 10 p.m. But by Australian standard, that is late already.
So
That's what I heard about that
in
too.
Hong Kong, shops are open 24 hours.
Some shops are, but even if they don't, they don't close at 5 p.m. Like that's when
Yeah.
people get off work to buy your grocery. But yeah, Australian supermarkets can close at 5 or 6 p.m.
Wow,
Yeah, yeah.
that would be hard.
Uh, this feels like a very similar experience I had in Switzerland as well. Because after work at 5 o'clock, we have to like drive home and rush to the shopping, the supermarket before they close off at 7 p.m.
Yeah,
It's like, this is so crazy. And then after 7 o'clock, the whole street is just empty.
yeah.
So that's so strange for me. But these are some of the cultural things that you do find differences that you do find in different countries, and it's a really new experience. Yeah.
It's
Yes.
always like when I came to Malaysia too, I discovered people can still go to restaurants by 2 a.m. It was the strangest thing ever. Nobody gets out of their homes after 9 p.m. I'm back
Exactly.
home. So it's like how can you until I think one time I met an entire family, grandma, grandpa, and everybody, and they said they were coming out for tea. I'm like, tea? You sure this?
That's
Yeah.
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 Yeah, I think now I'm used to it.
Yeah, that restaurant's just below our church opens 24 hours.
Yeah.
And one time we were
Wow.
passing by at about 2 a.m. in the morning, and there was a huge line just lining up for food at 2 a.m. in the morning.
Yeah.
So yeah,
Fine. Wow.
so
So I
that
was like, what do you call that? Breakfast or
uh,
pre-breakfast
that's more like a supper
Maybe
for us.
night shift. Night shift. People who've ended.
at, at 2 a.m.?
Yeah,
That's no supper.
But that
yeah.
reminds me of this thing called reverse culture shock. So culture shock when I was in Australia have generally been nice, but reverse culture shock not as much. And you just have to be aware that it exists. When you come back from your host country to your home
Yeah.
country, you sort of have acquired a new set of a new worldview, a new mindset that might not fit very well back in your home country.
Yeah.
Or you have learned new things that you think, oh, this way of work is better, but then you come back to your old way of work, and that is less pleasant than culture shock, I would say.
Yeah. It happens.
Just being mentally prepared for these things.
Yeah. Okay. Dr. Sadie, do you have any other questions before we
I
enter the
think,
closing section?
let me see. Okay, so I have this question here. Looking back, what will you tell your younger self before starting this journey?
Oh, definitely look at your program description, like what you're getting yourself into. But I would tell my younger self to just go for it. Because what my younger self has done has led me to a pretty good place. I'm pretty happy with um, the freedom of choice that my younger self has given me. Like, I do not like one good thing about a professional job like a speech therapist is I don't have to forever be a speech therapist. Like I said, I became a bread making instructor, and for me to have the financial freedom and the security to do that is, I do not take that for granted. Like, I thank my younger self for the foresight that she had to pursue a professional degree that allows me to get back to the field anytime I want, but also at the same time give me the freedom to pursue something else if I see something down the road that I feel like I might want to try that. I might want to try that. Like I tried many jobs in my career history, and in the future I might do the same. Yeah, so just go for it. And
So I'll say, positive as that sounds, if you had to do it all over again, is there anything you're going to do differently?
um, yes, I would probably. I picked a master's degree with a university that focuses a lot more on education, and as a result, kids. So working with kids. If I have to choose again, maybe I will look more closely to the program description to decide that another university that focuses more on medical knowledge and medical placements would be more suitable for me. Um, but you never know. Kind of like you make mistakes. You just be flexible with
You get
it.
around them. So
Yeah.
my final question is, now that you are a retired speech therapist, is that what you are?
I
Mm.
hope to get back to it at some point. But now I'm a full-time mom.
So as a
I
full-time mom, do you miss being a speech therapist, and
I do.
how
I do.
desperate are you to get back to it?
I'm not desperate. Like I enjoy being a mom,
Okay.
and I foresee myself to continue momming for the next at least few years. But I do miss being with patients, actually, especially old people, um, and I just miss working with a dynamic team. And when you're working in a healthcare setting, that's usually what you'll get: a dynamic, efficient, uh, organized team that you work with, and the adrenaline that you get from working with a team like that. I do miss that, but right now I'm pretty content.
Okay, so what you're experiencing now seems it's like what most women do experience, especially if you choose marriage and child
Mm.
bearing and rearing. So the last thing I would want you to speak to is, what are you doing to stay relevant? Because now you are mommy, you say you're going to do it for a few more years. So let's say you are out maybe 5, 6, 7 years. So by the time you come back, speech therapy is definitely not going to be where you left it. So what are you doing to stay relevant so that if you come back at any time, you can still go in?
I am required to do continuing professional development. So
Okay.
every year you choose to whether it depends on what you're interested in. You can do a webinar, you can do a training course, you can read research articles, something that keep you updated with what is going on in the field. I have to do it annually. I have to submit to the speech therapy body in Hong Kong that this is what I did every year.
That's good.
So that is keeping updated with the theoretical knowledge of the field. The clinical touch will it will never be the same as when I left the field, but I expect to be able to reacquire it very soon after I restarted the work. But another thing I could do is freelancing, actually. So very sporadic gigs that I could do here and there. I have given talks, speech therapy talks, if I wish, and if locations and timing are perfect, I can actually take up work, speech therapy work. Like one morning session in a nursing home or an afternoon session in a school and stuff like that. So there are ways to keep updated and staying afloat. But
Yeah, I just want our audience to hear that. So some of them might be going through this and they're feeling like, hey, what am I going to do? So this is the way.
The flexibility is another good thing about the field. Flexibility in terms of the amount of work and the nature of work that you can do.
Okay.
Is quite a lot.
Thank you.
Yeah. Thank you so much, Emily, for being with us today. What a joy to speak to you
and
to explore this field.
It's a pretty unique experience for me as well to talk about.
Yeah, for us too, listening, it's been a unique experience and learning too. Yeah. First time talking with a speech therapist.
Yeah. I remember when we met at the conference, when you told me you're a speech therapist, I was super excited. I was like, oh man, we got to talk about this. We got to tell our students like this is something that you should really consider. And no regrets. And I hope that our audience has been able to pick up a lot of the gold nuggets from this stream, and hopefully that would give you some idea of what to pursue. And as Emily has shared, during her younger self, she wished she would be able to know a little bit more about what the course description is. And I think when you're in that stage of choosing where to go and deciding on your future, it's quite easy to get yourself lost in all the amount of information that's available to you. And it would be helpful to have consultants and people who knows these things to help put things together for you so that you can get clarity about where you should go and what to pursue. And that's what Arrows Education would want to do for you. We aggregate all this information that is relevant to you, deciding based on your results, your transcript, and we come up with the best the best few options that are available for you and helping you to know exactly what you're getting into. And so reach out to us on our website, arrowstransactions.com, or reach out to us on our WhatsApp, which is on over here on this number here, and all our social media. Reach out to us and we'll have a consultant talk to you and help you through this this matter. With that, thank you again, Emily, for joining us.
No problem. Thanks for having
Thank you.
me.
Thank
Yeah,
you. Say hello to your baby.
yeah.
Thank you. I will.
Yeah. All right.